Hi, I'm Sophie, nurse practitioner at Turner Medical Arts. These short episodes are all about real women's health and my clinical experience and knowledge. This is a channel where I talk about all things hormones, perimenopause, sexual wellness, birth control, weight support, and everything explained simply without the confusion. Let's dive in. Hi, it's Sophie, nurse practitioner here, and today I'm going to be talking about a hot topic, and that is perimenopause. So, perimenopause is the time in a female's life when they are entering that stage of slowing down and entering menopause. And that can sometimes last for years. And the unfortunate thing is that a lot of people are having really severe symptoms. So those include really heightened emotions, changes in your mental health. People are experiencing really irregular periods. Sometimes people are skipping periods. They're having much more bleeding than they had before. They're having much longer periods. And they're also starting to have menopausal symptoms. So vasomotor symptoms like hot flashes and night sweats, sometimes brain fog. And the question really is, what do we do? So, one of my recommendations for this patient population, first of all, if the bleeding is really bothersome, or this is a patient who's open to using something that could stop their period, a great option is actually using an IUD. I like Mirena. And this is an IUD that can also be used for endometrial protection. And what that means is that if we're going to try and treat those vasomotor symptoms, the hot flashes and the night sweats with hormones like estrogen, the Mirena together with the supplemental estrogen actually can cancel each other out. So instead of having extra estrogen that's unopposed, you have the Mirena in there that prevents the lining from getting thick inside the uterus. So that's a great option to not only combat the heavy periods and a lot of cramping and uncomfortability, but also the vasomotor symptoms, the hot flashes, and the night sweats. Another thing that I really have seen a lot of benefit from, if the patient is a good candidate, is using a really low dose of an SSRI. Citalopram, also known as Lexapro, is one of my favorites, and that can really help with some of those mood swings. A lot of times people feel extremely irritable and easily aggravated. So that's another thing that I have in my toolbox and use when it's appropriate for people to help stabilize them and try and get them through this transition. It's not for everyone, but it's really great to come into the practice for a consult so we can come up with an individualized plan and see what would work best for a certain person.